Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we are going to continue talking about GI medications. To be more specific, we're going to talk about antiemetics, laxatives, and anti-diarrhea medication. So antiemetics. Antiemetics, an example for this is aldosterone, Zofran. We all know Zofran, right? It's used to prevent what? Nausea and vomiting related to what? Chemotherapy, radiation, post-operative patients, and also with pregnant women. Its mode of action is it blocks serotonin receptors in the CTZ, which is chemoreceptor trigger zone. Side effects include headache, dizziness, as well as GI upset. We need to remember with this medication, we administer it to chemotherapy receiving patients prior to chemotherapy. Okay? Laxative. We have various types of laxative. Examples: Psyllium, Docusate sodium, Bisacodyl, and Magnesium hydroxide. Psyllium is a bulk-forming laxative that softens the stool and increases its bulk. Docusate sodium is a suffocant laxative. It softens the stool by increasing water content. Bisacodyl is a stimulant laxative which stimulates peristalsis. And lastly, magnesium hydroxide is an osmotic laxative that draws water into the intestines and also promotes peristalsis. We always monitor the patients for signs and symptoms of magnesium toxicity. So with laxative, they are used for constipation and they are contraindicated for any patient with a bowel obstruction. We encourage the patient to increase their fluid and fiber intake and encourage exercise. With exercise, we're talking about motility. Let's get them moving so their bowels get moving. So we also have a laxative that is used for hepatic encephalopathy. And when we talk about hepatic encephalopathy, we are talking about ammonia toxicity. So this is lactulose. It is used for constipation, but it's primarily used for hepatic encephalopathy. It's used to decrease ammonia levels and improve the mental status of patients with hepatic encephalopathy. So its mode of action is it lowers the pH in the colon, which in turn promotes ammonia excretion. Side effects include GI upset, electrolyte imbalance, and hyperglycemia. So for these patients, when they ask you a question, this patient had hepatic encephalopathy and we administer lactulose. How do we know the medication is working? We always check about the confusion, right? If the patient is no longer confused or their mental status is back to baseline, because not everybody is alert and oriented times 4. So as long as the patient mental status is back to their normal baseline, then our lactulose did their job. Lastly, antidiarrheal medication. With antidiarrheal medication, we are trying to treat what? Diarrhea. So examples include loperamide. So mode of action for this is they stimulate the opioid receptors in the intestine, which in cause decreases the motility and increases absorption of sodium and water, right? Think about opioids, right? What do the opioids do? They suppress your system, right? So if we are triggering our opioid receptors, that means we are trying to slow down your intestines, right? Its motility. Side effects include constipation, because we are slowing down everything, so everything is slowing down. We are at risk of having constipation. We'll be drowsy. A high dose of defeniloxate plus atropine causes anticholinergic side effects. So with diphenoxylate plus atropine, which is an antidiarrhea, we always check for side effects of anticholinergic effects. And when we talk about anticholinergic is what? We're talking about the dry effect, right? Retention of urine, constipation, dry mouth, dry eyes. Prokinetic agents. With prokinetic agents, we can talk about Raglan, which is also metoclopramide. So its use is for nausea and vomiting, as well as gastroparesis and GERD. Mode of action. It accelerates gastric emptying and blocks dopamine and serotonin receptors in the citizen. Side effects include drowsiness, GI upset, extrapyramidal side effects, which are muscle rigidity, tremors, twitching, restlessness, and tardive dyskinesia. So, IBS medication, which is irritable bowel syndrome. With IBS, the treatment depends on what kind of IBS you have. It's either if it's IBS with constipation or IBS with diarrhea. So we have two medications that we use, which are alloxatron and lubiprostone. So when we are treating IBS with diarrhea, we use alloxatron. This medication works by blocking the 5-HT3 receptors, which increases firmness of your stool and decreases the urgency. Key side factors is what? If we were preventing diarrhea, we could end up with what? Constipation. So with IBS with constipation, we use lubiprostone, which increases fluid secretion in the intestines and increases intestinal motility. Side effects could be nausea. Since we are trying to prevent this constipation, we could end up with worse diarrhea as well. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.